After our report on the negotiations between CenterWell, who now owns the Village's Health, and UnitedHealthcare, we got an email from a viewer who has worked in benefits administration for about 2 decades. He offered us his expertise on the negotiations between UHC and CenterWell. I'm your Sumter County Community Correspondent, Emily McLeod. I decided to take him up on his offer, and he says there's several reasons why these talks to hammer out a contract may run up to the 11th hour.
It really is two opposing forces. It really is a tug of war.
Kevin Day has worked in benefits administration for 25 years and says these longer negotiations are becoming more common. He says costs could be playing a part in these discussions.
From a UnitedHealthcare standpoint, they want to pay the least amount for the services. So they say doctor's visit is X dollars right now, and in the contract they want Y. They're going to push for that lower amount. Conversely, from the clinic side, they're saying, well, we want to be reimbursed for our time. So we have to pay our folks more. Equipment costs more, liability insurance costs more, all those things that go into running a doctor's office or a practice. And they say, we want to be reimbursed a greater amount from UnitedHealthcare.
The Village's Health sale to CenterWell, a division of Humana, closed on November 7th. That same day, the Village's Health CEO, Bob Trin, sent out this notice to patients saying if no deal is reached, TVH can no longer accept UHC plans beginning January 1st, 2026. What do you think about how the sale is kind of playing into all this? Do you think it's playing into all of this?
Yeah, absolutely. And especially the fact that it was sold to a Humana entity. So now you have two different carriers, which of course are competing in the marketplace.
Day says it's possible we could see this again with other carriers, though the Village's Health says it will accept plans from Florida Blue, Aetna, Humana, and CarePlus in 2026.
And then if the provider wins out and says, hey, we got a better deal, we're getting more money now for our services, then they're going to want to re-up that with all of the other carriers that they deal with as well.
Now, Day says there is hope. He says he's been through negotiations that last up until the last second and the contracts were finalized. He also says people with UHC should do their research in case the deal doesn't go through and make sure you make any changes before your deadline. Reporting in the newsroom, I'm your Sumter County Community Correspondent, Emily McLeod, News 6.